I would like to introduce now Dr. Terry Jo Bichell. Dr. Bichell is a real force within the rare disease community. She saw unmet needs and systemic issues, and she decided to take them on. And Cure KCNH1 just recently joined Combined Brain, but every meeting I've been to, it's like, yes, thank goodness someone is working on this and I don't have to do it all myself. So I am very pleased to have her share a bit more about how valuable and pivotal patient data can be in advancing the research.
Okay, well, thank you so much for inviting me to speak today. I've really been enjoying the meeting and learning a lot more about KCNH1. We're so happy that you all have joined Combined Brain. So I'm here to talk today about how natural history is power. And in fact, natural history is the rare patient's most valuable resource. For the families of patients who have rare diseases, what you have that everyone needs is information. You know more about your life and the disease that your family member is suffering from than anybody else in the world, and that is power. So, Combined Brain is an organization of nonprofit organizations, and we work to help everybody work together to fast track treatments and potentially cures for all of these disorders. We focus on rare genetic neurodevelopmental conditions. So, what I tell everyone is this is sort of a mock up of the timeline from discovering a gene to getting an FDA drug to getting a drug approved by the FDA. And so what you have to do in this timeline is, and you've already gotten a lot of it done. Your community is doing a fantastic job. So you ID the gene. It gives a real leg up once you know what the gene is, because then you can look at mechanisms and you can really make sure that you have patients who actually have the same disorder included in studies. You work on your rodent and cell models, and we just heard from Dr. Kearney, and you all have a lot of fantastic work going on in that realm already. You need to collect natural history, meaning collect information from people who actually have the disorder or from their family members. And then while you're doing that, you try to understand what the mechanisms are behind the gene mutations that cause the symptoms that you're seeing in the families. And I've already heard today some great presentations from clinicians who are collecting that kind of information and researchers who are looking for the mechanisms. Then you need to work on disease concept studies and disease burden studies, and that's a whole nother topic. And then hopefully that will help you lead to biomarkers. All of this will help you choose the right patient-centered outcome measures that you can then use in clinical trials. So if you look at this slide, everything above the line are things that family members and foundations really need to work hard on. They are the things that are absolutely crucial to have families and foundations involved in. Everything below the line is usually what you have researchers and industry working on, but the whole thing goes back and forth, up and down below, up above the line to down below, and back and forth the whole time. So you'll be giving natural history information to all the researchers who are working on projects below the line, and then vice versa. They'll have to give it back to you. So in a nutshell, we have had a lot of trials fail in the field of genetic neurodevelopmental disorders. And one of the reasons these drug trials have failed is because we concentrated on the symptoms of the poor rodents rather than what families and people were experiencing. We found what we could measure in rodents. Then we decided what we should look at in these clinical trials. Then we measured those things in the clinical trials, and then we weren't able to show efficacy. That happened with Fragile X, that's happened with several different trials. But now, partially because of a push by the FDA, patients are at the center of clinical trial development. And so instead of measuring what matters to rodents, we need to measure what matters to people and what matters to patients and their families. And then we need to collect information about what matters to patients and their families. And then we need to figure out what can be measured in the rodent models that really derives from what the patients care about. Then that leads to the right endpoints that we can use in clinical trials, and hopefully that will lead to successful clinical trials. So in your field, in the field of your disorder, you've already gotten a lot of work done. And it started with the power of the first patient back in 1991 when the first case study was published about temple Baretzer syndrome. And that was a powerful thing because it put it in the map and it put it on people's radar so that then when you have 6 more patients, there's even more power. You can now look at those 6 patients, decide what they have in common, and identify the gene and the gene mutation behind those symptoms. That's a lot of power wielded because of information collected about 6 patients. Imagine the power of 27 patients, which at this point, you've already been collecting information, case reports and case studies on 27 patients and more. If you look at other manifestations of and symptoms of what KCNH1 mutations can cause, this gives you even more power. You can try to figure out exactly what the gene does, exactly why some people may have different symptoms than other people, which mutations and which part of the gene cause which symptoms. These are the kind of things you can start to understand when you have enough information about enough patients. And so at this point now, this brand new paper that just came out, it's really powerful because you can now look all the way across the gene and try to understand really what the gene is doing, what the mutations are doing, why the different symptoms are being shown by different patients. So that's all very important. Powerful information collected in distinct moments in these families and these patients' lives. But even more powerful is information collected over time. Not just a one point uh, case study, but information about the same patient collected on a regular basis over the years. How does that one patient's life unfold? And what the FDA has said is that this information contributes to really being able to understand a disease and what we need to treat in a specific disease. So I want to just mention the difference between a registry and natural history. A registry is a point in time, and registries are very important. Everything I just showed you in the that was published in those case studies, those were really from single time points. I mean, some of those patients had been seen by the clinicians who published the papers more than one time, but in general, those are single time points. A registry is in general a single time point. And if you only fill in the surveys from a registry one time, that's still good. That's better than nothing. But imagine if you can fill out those registries over the long time of a person's life. You can ask things about when were seizures identified? How did they start? Will how what treatments are going to work the best? Will certain medicines work better than others? Did the seizures respond to certain medicines for a short period, but then stop responding? Did a combination of medicines work better? Did gross motor skills develop? When did the child hit certain milestones? What affected those milestones? Will the child learn to speak? What helped the child learn to speak? These are all things that you can learn over a longitudinal study, which would be a real natural history study. So, the definition of natural history is really gathering information about how a disease affects a person over a lifetime. And so this means gathering information whether you're treated or not, whether there's a cure or not, whether there's a treatment or not. We just want to know what your life is like, what the child with the disorder's life is like, or the adult with the disorder's life is like over time. And this information can be entered either by a physician or a clinician or a healthcare provider, or it can be entered by a patient or a parent or family member of a person. All of that data is really important and really valuable. So, what are some of the things that you can get out of natural history studies? Oh my gosh, so much. You might not realize how rich that information is. You can start to understand the disorder in a really full way. Catalog the symptoms, catalog the treatments. What are some people trying in some countries that maybe other countries haven't even tried yet? Record the quality of life. What is it that affects the quality of life the most? Is it communication? Is it motor skills? We heard from some of the family videos today that some people just wanted to hear the words, I love you. Some people just wanted the child to be able to communicate, even if they could never actually walk or move. I mean, we need to understand what is it that affects quality of life the most in your family. And then you can inform researchers about all these subtleties. What is it about that they really need to be focusing on? What would a treatment really, how could a treatment help you the most? And then we could figure out how to track whether treatment's working or not. So if a treatment helps in some way, but it doesn't help in another way, that might be really important to know. We don't want a drug to fail because it only helped the child communicate, but it didn't help them walk. We don't want a drug to fail because it only reduced because it didn't reduce seizures, but it did help the child communicate. So we need to be able to track treatment effectiveness in all these different ways. Um, and then also you can use natural history to develop standard of care. So what that means is that you could actually have a specific way that any doctor around the world would be able to treat people with the mutation. So if they have a kid, a patient, or an adult with the mutation in their caseload, they could look up online, what's the best seizure treatment? What's the best therapy to use? All of those things can come out of a natural history trial. And also the timeline for a disorder. When is it that seizures hit for the most part, depending on the mutation? Or when is it that milestones hit, for example? And that can help figure out when do you actually have to treat. So at what age is it the most important to treat the child to prevent the most severe symptoms. So these are all important things that can come out of natural history. And also you can come up with new biomarkers. So you could actually, if once you have the description of the timeline of a disorder, you can actually look for biomarkers, maybe in blood, maybe in cerebrospinal, maybe EEGs, maybe in MRIs, that could actually show whether the child is getting worse or better according to treatment or just through natural history. And then what's really cool is a natural control group. So I think if my slide will advance, there we go. I'll be able to tell you about that. And I saw one of the previous speakers use the same slide, borrowed from the Test Foundation. And what this shows is that if you have really good natural history, really well recorded, really to a standard that the FDA can accept the data, then you might be able to use the natural history as a control group in addition to or instead of a placebo. So a lot of times when we have clinical trials, families really are worried about participating because they don't want their child to be one of the ones on a placebo. And nobody really wants to be on a placebo because we want to try a drug to see if it really works. And so what you want to do is reduce the number of kids that have to be on a placebo. And one of the ways you can do that is by increasing the caliber of the quality of your natural history data. So what would happen is if you look at this graph right here, if you, or here, let's start with this graph. If you look at a placebo group and you count the number of symptoms, you can see that the placebo group is developing more symptoms than the group that's treated, in which case this treatment ought to be recommended because it's reduced the number of symptoms. Well, you could do the same thing with natural history if you just show that the treated group is actually not developing as many symptoms as you would expect just from collecting natural history. And this has already been done. In the case of spinal muscular atrophy, which is a very severe disorder, it has several different types of SMA, and the most severe types result in they're fatal and very, very severe. And then there's a second severe type that is also eventually fatal, but not quite as quickly as the most severe. And then there are other types that result in sort of pretty severe motor issues, but they are not fatal. And so they used in the trials for spinal muscular atrophy, natural history as a control. Part of that was because the families and the organizations working with spinal muscular atrophy had done a really good job at collecting natural history so that they could actually predict which group, type 1 that was the worst, or type 2 or type 3 or type 4, which group would the person be in. And then they could also predict absolutely when they needed to give the treatment, when was the best window to prevent the worst parts of the disorder. So this is not just a dream, this has actually been done. And SMA now has so many treatments, gene therapies, antisense oligos, compounds that can actually, they're completely life-changing for people with SMA. This is another example of natural history being used as a control for SMA, and they were looking at the number of fatalities of people with SMA experienced up to the age of 14 months. And they were also able to look at the number of times people had to be put on a ventilator. And what they could see is that people who were on the drug, which is this green line here, were able to avoid those events, those being put on a ventilator and survive, um, so much obviously better than people who had not had the treatment. And that was not people on placebo. Those were people who had been collected in natural history trials. And then this is my own example. This is a picture of my son down on the bottom right. He's an adult with Angelman syndrome, and this is how I got involved in the field of rare genetic neurodevelopmental disorders. And we've collected a lot of natural history for Angelman syndrome. And I'm very proud to tell you that one of these little red lines right here is my son. And his being one of these little red lines has a huge contribution to the field, because what we know is that if you have a certain kind of mutation that causes Angelman syndrome, we expect that your cognition and your receptive communication and your expressive communication, see down here in all this red fuzzy stuff, is going to be at a pretty reduced level compared to the people who have another kind of mutation and compared to the control group. And so, frankly, if my son from a treatment were able to rise up to this ability level up in the blue section, which is a different type of mutation, I would be very happy, and it would improve our life a huge amount. And so this information is information that we can use in clinical trials for Angelman for my own son. And so now I'm almost done. And what I'm going to tell you is that natural history is a big hassle. It's a big hassle. This is my business. This is what I do for a living. And I have a hard time filling out all those surveys. It's a pain. We already have complicated lives when we live with a kid with a neurodevelopmental disorder. We've already got to juggle medications and caregivers and feeding and toileting and sleep and all that other stuff. Who has time to fill out these ridiculous surveys? And sometimes they ask me the same questions over and over. It drives me nuts. And sometimes they ask me questions that really are not relevant to my kid. And it's aggravating and it's frustrating. And I see no benefit in the short run. So why should I do it? Because it's the most powerful thing I can do to help my kid and other people with his disorder. And I'm a crier, so don't worry about me. I always cry. But the thing is, I'm telling you, natural history is a pain. And it is the most important thing you can do. The power is really in your hands to cure KCNH1. And that's all I've got to say.
You're amazing. Standing ovation. Thank you for being real and honest and letting us know the power and the pain of collecting this data. I really appreciate your time.